Hello, everyone. Welcome to the Flint Community Webinar, your community resource every Friday at noon. We have a fantastic lineup for you today. I'm so excited to bring on the expertise we have. We've got Felicia Eshra, Flint Registry Director of Implementation with the Flint Registry. We've got Nicole Matthews, who's going to talk to us a little bit about back to school safety. We've got Carrie Chanter here to talk to us about National Suicide Prevention Week. And we've got Shannon Czak here to talk to us a little bit about stuff at the Genesee Health Plan and to talk about their drive-through vaccine event. So we're so excited to bring this wonderful expertise to you. We're going to start with the Flint Registry. And so Felicia and I were just talking about how we have dueling offices in FJB, and our offices are sort of right in different spaces. She probably has the better space, but that's not what we're that's not what we're going to talk about. But it's nice to see you.
Thank you. It's nice to see you as well. Yes, I was making some West Wing jokes because every day is a great day to reference.
Obviously.
Especially in today's political climate. So thank you for having me. I'm so excited to be here and give an update about the Flint Registry. I know that we have talked about the Flint Registry on this webinar before and are so appreciative of the partnership and would love to continue to bring updates of what we are working on. But I'm just going to do a quick reminder or refresher about what the Flint Registry is. So we are a public health project looking at the impact of the Flint water crisis. We take a enrollment survey and we use that to connect participants and members to resources and services, and then continue to engage with our members through the length of this longitudinal study to continue to make sure that our members are connected to opportunities within the community, as well as options for continuing to hopefully mitigate the effects of the crisis. So the registry is for anyone who lived, worked, went to school, or daycare in the city of Flint, or where the water system was hooked up to during the water switch. So between April 25th, 2014 and October 15th, 2015. For those of you who also have no concept of time post-COVID, it is 2023, which means that next year, next April, it is 10 years since the water switch, which we will bring up in a little bit. So this was 9 years ago, and we are looking at the effects of access or exposure to this water over a significant period of time. Our program is funded by the Center for Disease Control and Prevention. It started as a grant based off of the WIN Act from Congress in response to the water crisis. And now we are continuing on a second 5-year grant based off of congressional appropriations and a continued CDC funding. With that, we are charged with improving public health. The 4 main goals that the CDC set forth for us that we take as our primary directives is to support our community, to monitor health development and utilization, improve service delivery, and to coordinate with other programs and federally funded programs in Flint, as well as across the country. We have worked and partnered with other burgeoning registries or other organizations that are looking to help mitigate effects of different public health crises. So we really see ourselves, we have patterned ourselves after the World Trade Center registry, and then we take that and use our lessons learned to help improve other similar programs around the country. We do that with our incredible people. The majority of our staff are either Flint residents, Genesee residents who were impacted by the water crisis themselves. And then you've got some of us who make poor decisions and say that we will be pied in the face when we hit our enrollment goal and then have to actually do that. So may this be a lesson to you to be careful about what you promise. But we could not be luckier. We have an amazing group of people, and the people really do make the heart of the Flint Registry. The people of Flint are who we do this for, and the people we work with really make every day amazing. And that's also what makes the registry our principal investigator, Dr. Monahana Atisha, It is a powerful tool to understand, measure, and improve the lives of those exposed to the contaminated water. The more people who participate, the more powerful the tool is. So with that, our enrollment always remains open. If you do fit that criteria, that enrollment criteria, and are not already a member of the Flint Registry, you can go to our website, flintregistry.org, and we can get that process started. Why does the registry matter? Well, we have a saying that we want to be counted, connected, and supported. So let's start with counted and looking at the numbers. We currently have over 21,000 individuals enrolled in the Flint Registry. To be enrolled, you complete an enrollment survey. We call that our baseline survey to see where we are starting after the exposure of the contaminated water. From that survey, we will make referrals to services that we think you might be eligible for. And to date, we have made almost 35,000 referrals. We'll talk about that in a little bit. We have made those referrals based off of both our initial enrollment survey, and then we were doing a follow-up survey 1 year post-enrollment for our early enrollees to see what the difference is in service utilization, in health and mental health with our enrollees. And then we also are now starting to do mini surveys for smaller parts of our membership to really dig into different areas to see how different things are impacting our community, different thoughts. So we have done a child mini survey looking at household hardship and resilience, using that to inform future services that may be available. So this is a quick snapshot of who is part of the registry. We have members all over the city. We have both adults and children, so parents can enroll their children under 18, and we have specific children and adult questions, and then specific children and adult services that we refer to. And why this all matters. Why does the survey matter? Why does a registry matter? We do that because the most important part is telling the story of the Flint community and the impact of the water crisis. So we collect this information, we analyze this information, and then we share this information. So part of this, if I was smart enough and could make this work, which I wasn't, I apologize. I promise I'm better than this. Our website, we have results. It is one of our pages on here. I've got it linked in a second. And this, we update information about the information we've taken from the survey. For example, health concerns, looking at that we have 20% of our children have special education or an EIP. If we are looking at the comparison of mental health and physical health, you can see that we've got 67% of parents have reported that their children are in very good or excellent physical health, but only 57% of excellent or very good mental health, which is still great. 57, I do not want to downplay 57%. But the difference between our mental and physical health as a collaborative or a combined is something that we are very interested in and have taken a very specific interest in trying to support continued services for. We look at preventive care with dentists, immunizations, and then the same with adult health. We have general health, physical and mental health. Again, we can look at the difference. Comparatively with adults, mental health is shown as better than physical health. And again, this is self-reporting versus reporting from parents, but still something that we want to make note of. So we have information available on the website that we continually update. We also are in the process of submitting and publishing additional scholarly papers, and we continue to share those as well. So the Flint Registry website, flintregistry.org, is where you can go for all of that additional information. So now going back, because that's how that works. Also, as I mentioned before, about the 10 years, we are asking for testimonials from community members about how the water switch has impacted you. We are planning a special report based off of the information from our surveys because this a registry is not a short-term project. We want this to be a long-term story of the impact of the community. So if you're interested in sharing your story, we would always love it. You can go to, again, our website and share your story, and there's a form there for you to be part of that. Again, this is a screenshot of our website. Recommend going. We also, every 2 years, the Flint Lead-Free Work Group, which is co-chaired by the Flint Registry and the Community Foundation of Greater Flint, has a work group that works on lead mitigation in all forms, not just in water, to get the lead out of Flint. The 2023 report, every 2 years, the report is published, looks at how this is going, what lead mitigation looks like, what blood lead levels look like, the economic impact of lead and lead removal in the community. So this report also available, highly recommend. It is a really great piece of information. We also have the 2021 report if you would like to compare all of those, again, on our website. So next, we've been counted and now we need to be connected. We take our survey and we use that information to then refer to services. We have 4 domains: health, lead elimination, child development, and nutrition. Again, like I said, just under 35,000 referrals are sent. 80% of people who have a survey receive a referral. And then those who receive referrals on average get a 2. So we are really looking at across all of those domains to make sure that your eligibility, and we say we over refer. If there is any possibility that we think you are eligible for a process, we will refer to make sure that you have that opportunity. Some of the services that we refer to for children, we need to change this name. It is no longer the Neurodevelopmental Center of Excellence. GHS has now changed it to Child Integrated Services, but this is for continued child development, lead safe home, and then Medicaid and community access programs. For adult, Fast Start was the pipe replacement program, access center, and then nutrition. We have found that access to nutritious food is one of the biggest needs, and this is both pre and during and post-COVID. It would be impossible to ignore the impact that COVID has had on everyone, but especially our community, managing 2 public health crises at the same time. So our follow-up survey did ask some COVID questions to try to see about the additional impact of that. But then also to connect as we continue to engage with our membership as well as the community. So we send newsletters quarterly with resources, other things that are going on, either at the Department of Public Health at Michigan State or in the community with community partners. Our amazing engagement coordinator goes to community meetings all over the city, all different wards, to make sure that we keep that connection. And then also planning and attending community events and connection to other public health studies. If you are enrolled in the Flint Registry, there is an option to consent, and only if you consent, to be sent information about other public health studies that we may be connected with in some way. We take data protection of people's information with the utmost seriousness. We will not share contact information. We will not share individualized information from those surveys. If you have consented to let us send you information about other public health studies, we will do that. If we have a data use agreement, and if we have, again, consent to share, we have worked with a few other studies at the Department of Public Health that have very similar long-term interests of the Flint Registry. We will work with that as well. But we I cannot stress enough that protecting everybody's information is I would say the number one thing is getting people to services and things that will immediately help them. And number two, probably it's like 1B, is making sure that everything is locked down. So we engage in a way that protects everybody's information. So then be supported. We, again, are a longitudinal study, so we are going to keep studying our membership. We launched our first mini survey in June, and then we have another one planned for February 2024. Again, those mini surveys are 10 minutes max. But then our big surveys to really dig into how has your service utilization helped your physical, mental health, your economic status, any of these. So our big next wave or our follow-up survey will be planned around November 24. We would like to avoid all of the election-based emails. Everybody gird your loins. Winter is coming. It's going to be a thing. So we just want to kind of try to avoid that a little bit. In the past, when we did our one-year follow-up survey, individuals got the opportunity to fill that survey 1 year from when they originally enrolled. We will no longer be doing that. We will open up the survey to everyone at the same time. We'll probably stagger how you get your code, but we're going to open it for 6 to 9 months. It's going to be open and then it's going to be closed. And then you don't have to hear from us for a little bit. And then we will take that and we'll analyze it and we'll go through all of that. And then we'll do it again in a few years. But we will be doing, again, targeted referrals and connections based off of that survey to continue to help to support our community. But the most important thing to do that, if we want to continue to get information, is we have to be able to talk to you. So we are always soliciting updated contact information for our membership. This way we can continue to share resources in between surveys, but also to make sure that we can get you the survey that you can fill out and then we can pay you for. So we do a tracing using public records. We continually encourage members to update their information if they move or if they get a new phone number or any of that on our website. And then also, again, in the community, if you see us, please come make sure we have your right contact information. This is especially the case if you or your child has recently turned 18. Of the exciting things, your insurance changes, and we also don't have to bother you about your kid anymore. So we will go to them as new adults. So we would love to be able to contact them directly and to be able to then continue to engage them in the Flint Registry, but now as an adult themselves and who are giving us new information about themselves. All of this, none of this presentation would happen without the community. We have a community and partner advisory board. The Flint Registry exists because it was a recommendation and request from the Flint community. We are community informed, community engaged. We continually want community and partner input. We are launching a membership advisory board of people who are enrolled in the Flint Registry, how they want the Flint Registry to continue to count, support, and serve them. And then we also, as a member of the Pediatric Public Health Initiative within the Department of Public Health, the Flint Youth Justice League, which is just a bunch of incredible youth, and our parent partners. So we continue to use all of these groups to inform the forward movement of the Flint Registry. But as always, if you have an opinion, we want to hear it. So on the website, we have, again, forms that you can fill out just to contact us. We have the availability for your testimonials about 10 years since the water switch, or really anything else. Our team members are, again, some of the greatest people I have ever had the opportunity to work with. If you have the opportunity to be on the phone with them, I promise you will walk away with a smile on your face. So if there is anything, please do contact us on socials, because we pretend that we are cool. Our website, our email, any of that. So we are not on TikTok because some of us are still old. But if that is the thing that we needed to know, that would be great. Otherwise, again, thank you so much for this opportunity. I would love to take questions at some point. I think that's probably at the end, but I will stop talking now.
No, you're so delightful and you're very cool. The Flint Registry is super cool. I totally co-sign it. And you know, I think all the coolest kids aren't on TikTok. But anyway, I wonder, you talk about how people can share their story and learn more, they can reach out to you. Is there a way that people should be engaging if they want to volunteer to be a part of this work?
That is a really wonderful question. So one, if you fill out the testimonial thing on there, we do ask, you know, how else would you like to be engaged? Our membership advisory council is the thing that we are launching and would love to know people who would like to sit on that. Again, our contact, if we on the website, flintregistry.org. If you come up here to contact, you can share your story, how to reach with us, and then also to volunteer. So you can put your information on here, but also if filling out online forms is not your gig, totally understand. Please feel free to give us a call at 833-GO-FLINT. Our phones are open between 9 and 5:30 Monday through Friday.
And then is it such that people can just stop by?
I mean, ish. We have not fully moved. We are still a hybrid since
That's
COVID.
what I was.
We are based in the Flint Journal building at the Department of Public Health. There is frequently someone there. More likely, community events, we will be there. The teddy bear picnic last weekend, which was a lovely, lovely event, and I hope some of you were able to attend. But we will also we do also on the website post, and on our socials post where we're going to be. So if you would like to stop by, say hi, let us know. If you do feel the need to come stop by at the office, say you're at the farmer's market and the only thing you can think about is the Flint Registry, which I don't blame you. That's the only thing I think about too. We probably have someone at the office, security guards down at the bottom will get one of us. But I will put our contact information in the chat as well as my email address if anybody would like to contact us from there.
Thank you so much. The Flint Registry team is awesome. And yes, our security guards in the building will make sure to get you where you need to go. Should the only thing on your mind be the Flint Registry when you've gotten some amazing food at the farmer's market.
Or before.
Oh, or before, like maybe you need to work up an appetite or something. I don't know. But also kudos to you about the point about the election emails, because I'm literally getting text as we speak from various people like, I want your support. So that is definitely a thing, and I appreciate you getting in front
I
of
would
them.
love to take credit for this. I cannot. Our incredible communications manager, Josh Kennedy, who may or may not be on here, in one of our check-ins, he was like, election ? And the face that I made was like, oh, I blocked it out. So we do. Thank you, Josh, for being on top of that. So yeah, we want to try to make people's inboxes a little less insane.
Well, thank you so much to all of your team. And Josh is blushing apparently. So FYI, you've done your job. Thank you to your team. Thank you for all the work you do. We super appreciate you coming and sharing your expertise today. All right. Another person with phenomenal expertise is going to talk to us all about how we keep our kids safe as they go back to school. And full disclosure, I've got a kid in the background hanging out with me today. So thanks for letting me know how I can keep her safe, as she had a half day at school. But how do we keep our kids safe as we're in back to school season, which is very adjacent to like virus season? So
I love the opportunity to come and share updates with the season changes with you all. And you know, I have spent many, many minutes talking about the data and the injury and the science behind the prevention of injury. So it's funny because it's school focused and back to school focused. I wanted to take the minute specifically, and a lot of my slides are directed to the kids, toward the kids in their audience, so that the parents can share that. all of the Safe Kids programs, which I'm going to touch on just a couple upcoming events as well. But if you go to the next slide, our injury prevention department for all ages, and then our Safe Kids, Greater Flint is part of Safe Kids Michigan. And again, so many different sources of data. Safe States is a big one that we work with, but Safe Kids is a national organization, and then we have many chapters within the state of Michigan. As the trauma center, we're the level 1, and I know I've talked about this extensively, but I always say level 1, we're level 2 Peds Trauma Center with Burn Center, and no matter what the season, I always repeat, as you know, the kiddos identifiers. So every season we need to make sure that our kids know their names and they know how to find their way home. If they're found by police and are asked, what's your mom's name? And they say mom, it's not helpful. So we do that one every season. Tomorrow's the superhero run. This is a super fun event. If anyone wants to come to the first aid tent and work with me a little bit, we are still welcoming some volunteers. So if you're there and you want to come hang out, please come say hi. We'll have a tent there. You can go to the next slide, please. Safe Kids Worldwide, like I said, if you go to safekids.org, there's so much injury prevention based science. Really terrific stuff around all the topics of injury. And then if you're interested in injury prevention, our symposium is coming up October 19th. It's going to be local. It floats all over the state. But the Michigan Trauma Coalition is hosting this, which is really exciting because we have regional trauma coalition hospitals. Again, the level 1, level 2 status of our injury care and the standards that we meet to excel. And then the Michigan Trauma Coalition, all the trauma centers belong to that, and we come together for this symposium. So that is through you can look at mitrauma.org and register if you're interested. So the next slide, please. When we look at back to school, what I'm going to do is, because we can spin off into bullying, we can spin off into kids being safe at home. If you go to safekids.org and look at the seasonal, right now I think is, and thank you, Heatherlyn, for putting the link for the superhero run tomorrow in the chat. So if we're all superheroes preparing our kids for their safety back to school, we think about the parental obligation, and that is making sure our kids are safe at home, that they know maybe some first aid, some CPR. We're aware of their social emotional health as they go back to school that can get, our risk factors might climb a little bit, going too fast and whatnot, are risk factors for injury. And then we look at things like bullying, and if they're adapting well, it's a change in the season, it's a change in their day-to-day. So injury encompasses all of this, keeping them and lowering their risk. If we go to the next slide, looking at specific parental to-do list, what we want to share with our kids, the Michigan State Police, I'm quoting specifically here, the essential tips are things like being safe and situational awareness, knowing that you have a safe place, whether you're waiting for the bus or if it's just kind of a day-to-day, walking home from school alone, being sure you're buddying up, making sure that our kids, they're not only aware of the situations that they're in, they're proactive, they're thinking about these things, and that they're staying calm if there are emergencies. We always want our kids to know how to dial 911. That's important. And then when it comes to the bus and the waiting on the street and all, if they're doing that, that they're not both alone or standing behind a bus and they're standing out of the way of the road. So those are, I think, really important. If you go to the next slide, it's always important to remind motorists and drivers, adults, it's not a suggestion. You're definitely supposed to stop for school buses. So if we remind ourselves to follow the law and the lights of those buses, to stay back and to stay away and use caution, driving slowly with lights or not, but slowing down and keeping an eye out. If you go to the next slide, please. The kids that the skills kiddos have and the skills that parents have, knowing that things are not suggestions and law, but then differentiating between the suggestions, knowing to wait for the signal, and cross safely, looking left, right, and left. Pedestrian safety is huge with Safe Kids, and it will pop up if you look at safekids.org. Of course, again, not talking to strangers, staying in touch with the parents, knowing a safe word if someone is like a stranger is trying to talk to them and they say, I'm your mom's friend, having codes essentially. And again, never entering a stranger's vehicle, staying in sight. If you go to the next slide, we are obviously the stewards of children, looking at teaching kids about things like playground safety. We know
Oh
that
no,
going
Nicole,
back
we
to
lost your
school.
sound.
My sound?
No,
Oh.
we can still hear you.
Is it there?
Yep, you sound fine.
I don't know.
Nicole, you're fine. We can hear you.
Oh, very good. Traumatic brain injuries, helmets. We're coming to the end of helmet season, but it's always a big thing. Understanding
All
if we're
right.
caring for our kiddos, teaching about what we look for, the clumsiness or loss of consciousness, personality behavior changes if they hit their head. We want to try to be aware of those and also make sure that they know what to look for in themselves. If you go to the next slide, part of, I guess, first aid in general is what if a child sees their friend or themselves, they have an incident where they're bleeding. You all know that have seen us before. We talk a lot about the Stop the Bleed program. First aid is super important, and just kind of preparing them, having those discussions is important. To stay calm, know how to call 911 again, washing your hands, staying clear of blood. But if you touch that, if you're carrying in a first aid scenario, how to manage that and how to be a little more comfortable and not panic if they're presented with that situation, and work with first responders. If you go to the next slide, please. ABCs of safety are important. But if it comes to an injury, if it comes to bleeding or their friend is hurt, alerting the police, addressing the bleeding and how we look at that and manage that. And then showing them with practice how to compress to stop bleeding if they're ever in need of that skill. It's kind of like the Heimlich maneuver, or it's kind of like any first aid. That's something that kids can do, or it might be harder to do a Heimlich maneuver or another first aid. This is something we can teach them easily. If you go to the next slide. Knowing that there's blood, I'm going to go through these next slides pretty quickly, but alert, knowing how to call 911, being aware, and what to say to their friends. The next slide is B. And if the bleeding is actually very bad, then we know that you can lose loss of life between 5 and 7 minutes, actually, if there's a really bad bleed, if it's pooling or splurting. And the next slide, the pressure is really important. You have to make sure child's safe. They've localized and identified bleeding, that it is life-threatening bleeding, and how to press. I don't have a C slide. It actually dropped off. I'm sorry, but compression and knowing that kids know how to compress. So the general safety and the playground safety is a very, thank you, just playground equipment that's appropriate for age. It's kind of simple, but sometimes they get a little too young to be on a merry-go-round, or making sure there's barricades on the sides. Playground safety is a large cause for injury. We'll go to the next slide, please. The general, oh, sorry, there was a playground slide there with some park and safety. Having parents with, if you look at all of these resources, having resources for the parent, knowing that having a first aid kit is super important, knowing how to use your EpiPen, being the trip hazards out of the way, and definitely using playground equipment also, which will have maybe a padding or a mulch underneath it. That's very important. They shouldn't be present on really high areas anyhow, but making sure they're not going to fall into something like a hard ground. But but the appropriate for age bracket is huge. I think if we go to the bottom slide for Safe Kids, there are so many kiddo safety resources, ourhurleymc.com, everything around the safekids.org. And then I'm always going to talk about car seat safety because it's important all times of the year. And those are our top mechanisms for injury are our falls and our burns and our motor vehicle crashes. They're always the top three. They change order every now and then, but they're all very preventable if we take some extra steps. So back to school.
Can you talk to us a little bit? We've talked here and there about car seat safety, but the car seat safety that I think people have wrapped their head around the idea that like infants and young children should be in car seats. Can you talk a little bit about the necessity for like, my kiddo here is still definitely in a car seat because I listen to everything you say. I'm like, oh, I got to make sure Nicole's not mad at me and that we keep my kids safe.
It's not a thing.
But also like, you know, when we were kids, we used to sit in the front seat with our parents, right? And so those are conversations I'm trying to have with her about, nope, the back seat is the safest and all of this. And maybe you could share a little bit about that.
I really think that there's just not an option. I'm sorry. There's not an option. Once you know that the belts have to go on the bones, period. All kiddos are different sizes. All cars are different sizes, and seats vary tremendously. There's very little consistency. But if the belts are on the bones, the way that the child fits in the car, that's what's going to determine not the age, the weight, the height, not as much as do they sit with their knees at 90-degree angle over the edge of the seat, and do the belts go over the bones? Because I'm telling you, those children, you know, they will talk you into, please, please, please let me go forward, please, facing, or, oh, I'm ready for a booster, get me out of the booster. But then they go in grandma's car and it's a bucket seat. And if that seatbelt is up on the soft belly and it is not on the bones of the hips, my gosh, that's the worst injury you never want to see. Because the next hard thing for that seatbelt is the spine. And in a crash, you and we used to drive around in big steel vehicles. Now they're all plastic. So we want to know that again, safekids.org, the ultimate car seat guide is there. But just simply belts on bones, and there just aren't options. We have to make sure the kids are safe. Thanks for asking.
That. Belts on bones. That's something I can remember. Thank you.
And us too, adults, parents. We should make sure your seatbelt's down on your hip bones, not sitting on your soft belly. Have a great autumn, too. Thanks.
Yes, Nicole, thank you so much for all of your wonderful expertise. It's so helpful. Are there any last points you want to make sure to leave people with before we transition away? I heard belts on bones. The last time I think you left us with like ramen noodle is not as safe as we think it is, right? Ramen.
We're coming into space heater season too. Oh my goodness, distance from space heaters. That's a very scary house fires, burns. And ramen noodle burns are very, very scary. So these are things that are going to uptick in the upcoming months. Halloween safety, we're going to have fun with that one. And then we've got all the winter sports and risk factors. So Safe Kids will shift by season too, and I'm always happy to update. So thank you.
Well, we're definitely going to have to bring you back because I got to hear all about these winter sports things and how to keep my kids safe as we transition into the winter. Thank you so much, Nicole, for your wonderful expertise. We really appreciate you. We're going to transition a little bit. We're going to talk a little bit with our wonderful Carrie Chanter, who is always here to bring us the best, most recent, most trusted expertise, and is going to be talking to us a little bit today about Suicide Prevention Week. And every time, Carrie, you come, I learn something, and I think about how I need to be thoughtful about my language and how I can be thoughtful. And I'm really glad to have you here this week to talk about this so we can understand more.
Thank you so much, EJ. I'm excited to be back. September is Suicide Prevention Month, so it's appropriate for me to talk again about this topic. The last time that I was here was in June, and I shared a lot of data with you, so I'm not going to go over that data again. I like to just say to people, listen, we like to focus on data so much, but ultimately, isn't one death to suicide too many, right? So do we really need to pour over the data? And honestly, with suicide data, it's not always accurate. that specific topic, there's lots of reasons why we don't necessarily trust all of the data. And that's a system that's continuously trying to improve. And that's some of the work that our local coalition is going to be focused on. Okay, so just as a reminder, September is Suicide Prevention Month, and there's some important dates to remember. Luckily, we are in the middle of National Suicide Prevention Week. So that's kind of cool. And then World Suicide Prevention Day was September 10th. And then National Law Enforcement Suicide Awareness Day is the 26th. But again, all of this is Suicide Prevention Month, and September is so important. Just to let you know, we have a local coalition, and we started in March. So we've got about 6 months underneath our belt, and we have lots of participation, really important stakeholders at the table, and we've got some activities planned for this month. And we're releasing a press release next week, so we're really excited about that. We'll probably get some media coverage from that. I apologize. You can hear a lawnmower outside. This is exactly when I would expect for this to come in, just right now. Anyways, we've had a lot of social media posts. So if you're not following GHS's Facebook, please do so, because there's a lot of really great resources, videos, links that we share at least probably 3 times a week during Suicide Prevention Month. The really exciting thing is that we have a QPR training that's scheduled at our September coalition meeting, which happens to be the 4th Thursday of the month. And the next one is September 28th. It's Thursday. And I'm going to talk to you about how you might want to sign up for that QPR training and what that QPR even means. We also have an Out of the Darkness community walk that's going to be starting at U of M Flint at Wilson Park on the 30th. And I'm going to talk a little bit more about that as we go on. So again, if you missed anything, you can always email me. I'll put my email in the chat, and I will always connect you to whatever resources that you need. So I mentioned a QPR. QPR stands for Question, Persuade, Refer. It's an evidence-based suicide prevention training. Real people use it all over our country. It's an awesome training because it's not going to be 2 hours. It's probably about 90 minutes, just so that you know. So we're going to hold that in person, and it's from 9 to 11. We're going to be holding it at our new children's building, which is the Center for Children's Integrated Services. And you can either do it online or virtually. So I will plop that registration link into the chat box if that's something that you would like to participate in. Again, our next meeting is Thursday, September 8th. You are more than welcome to attend. We invite all people. We have concerned community members. We have people from mental health, school health, K-12, universities, law enforcement, mental health providers, universities, all sorts of stakeholders, but you are always welcome to attend. Our normal meeting usually takes place from 9 to 10:30, but because this month is Suicide Prevention Month, we're doing the training from 9 to 11. And then right after the training, we're going to do our normal meeting from 11 to 12. So love to have you there. We're going to have a few tables of vendors. I know the VA is going to come and have gun locks there. I think we're going to have some prescription safety boxes. They're locked boxes as well from the GCPC. So there'll be some cool things as well as the training there. Okay, sorry, there we go. As a reminder, I just like to remind people that GHS has a ton of training resources that's supported by the Flint Recast grant. And if you ever go to our webpage, it's under GHS training, and lots of things that certainly apply to suicide prevention, like mental health first aid, psychological first aid, QPR, which we hold QPR once a month virtually. So if you miss it this month, that's okay. You can take it next month. Mental health 101. We have a suicide documentary that we're able to stream for people if they want to see it. And then we have something called Living Works Start. And that's my next slide, is that this is one of the most, I think, valuable resources that we can offer our community members. It's free. It's about a $40 value if you were to purchase it on your own. Living Works is an international company, probably the leading suicide prevention training vendor that creates trainings. It's excellent. It's an online, it's about 90 minutes. You can start and stop it. You do it on your own. Lots of really personalized and interactive tools throughout the training. So that is free. And you can either sign up on our training page to take that, or you can shoot me an email and I just send you the code And you can share that code with whoever, any of your networks that you want to. We've so far probably trained about 1,500 people in Genesee County with this one. And so we're really proud of that. So again, I will leave my email in the chat box, and you guys can always reach out to me about how to get licenses. Like maybe you work with a team of 10 people, no problem. Give me their emails, I'll send them an invitation and they can get signed up. So don't be afraid to ask me for more than one.
Can they also do it as a team, Carrie?
You know, they can. It's not necessarily designed to do it that way. I know people have done it that way. If you're able to sit down all together at once to do it, do it.
Awesome.
But if you need a certificate, like if you want your own certificate, it's probably better to take it on your own. Their certificate doesn't mean anything for us. It's just more or less if you want to have your own certificate. It's up to you.
Sure. That's awesome. Thanks.
Yep. So the next two slides I want to share, I think people forget that GHS already has some existing crisis supports in place. So we're really proud of our behavioral health urgent care. You know, you go to urgent care for anything from a sore throat, maybe a sprained ankle, but why don't we go to urgent care for behavioral health needs? It seems like they always go right to the hospital. Well, we don't necessarily want to send people to go sit in a waiting room for hours and then end up getting assessed and being sent home anyways. And we're trying to avoid hospitalization for people that might not necessarily need it. So if you wanted to go to the urgent care, it's open. We have 24/7 access, and it's kitty corner from Hurley. It's right across from our main building for GHS. It basically provides urgent care services to anyone, regardless of their ability to pay. And it's really meant, it doesn't have to be somebody who has having suicidal thoughts. It could be anything from just depression or anxiety or panic attacks. Maybe they need help with substance use. Or challenging behaviors from their kids. You can go right into the BHUC and they will help you. We have a prescribing psychiatrist there that certainly can help out with different meds that are needed. And there's definitely outpatient support that's offered after that initial visit. So it's open Monday through Friday from 8:30 to 10:30. On Saturdays, it's 10 to 6:30, but there's always after hours services that you can do virtual. So that's something to keep in mind. Also something called ICSS. And that is for kids in Genesee County that are from ages 0 to 21. And the whole purpose is to try to avert a psychiatric admission and an out-of-home placement. We don't want kiddos to have to be out of their home. So, you know, you can call if anything's challenging you, even your kid won't come out of their room. It doesn't have to be so severe as suicide. If you need help managing that kid, call the team. It's a mobile response team. They'll come out within an hour. They do an assessment. They help support and link to resources and safety planning for your kid. And so just keep that in mind. Super resource to have. So as I'm wrapping up here, I guess in light of Suicide Prevention Month, I would say this. Even if you've not gone through any kind of fancy training about how to deal with suicide prevention, all of us are probably at some point in our life going to be in a situation to help somebody. Maybe it's this weekend at a festival or a ball game or a barbecue. There are going to be times in your life where you're thinking, man, this person is in some serious emotional pain. And even if you don't know what exactly to do clinically, that's okay. We all are kind of like a safety net in our community. So this is an interesting, like a little graphic that's from NIH that says, you know what, if a person is suicidal or in severe emotional pain, there are things that you can do, like ask them. All of the models state that all the data says that it's important to ask them. If you think someone's thinking of suicide, don't shy around the topic. You need to ask them. You come right out and you ask them, are you thinking of killing yourself? Are you thinking, you know, of harming yourself or others? And you can ask them that. That's one of the first steps. Try to keep them safe, like reducing access to lethal means in their home, whether it be firearms or prescription drugs or car keys, anything that you think might help keep them safe. Being there, listening, acknowledging their feelings. Don't question, well, you shouldn't be thinking of killing yourself. You have a perfect life. You make all this money and have all these cars and you play all these sports and you're perfect. Like, don't challenge people's thoughts because that's their reality. You need to listen and you need to acknowledge that must be hard. I can understand why you feel that way, that type of language. Then your next job is to get them connected, which is, you know, 988 is our new suicide lifeline. So 988 can be used at any time. You can help them connect that way. You can help them connect to our local resources that I just talked about, and then stay connected with them. Check in once in a while. Say, hey, how are you doing? Because, you know, sometimes crises are very time limited. It doesn't have to be, 6 months of pain. It can be a very small fleeting moment of crisis for some people, but keep checking in on them. 2 more slides and then I promise I'll quit. Just as a reminder, the suicide prevention lifeline changed about a year ago to 988 instead of that long 800 number. In the last year, we've seen calls go up 40% nationwide. So we think it's a success that it was changed. When you call 988 in Michigan, it does 99% of the time go to a Michigan clinical person. It's not like you're talking to somebody in Las Vegas or whatever. It is routed here in Michigan. So that's good. And then as a reminder, all of those services that I talked about that GHS offers, this 257 number is really the place to start. You can call any of them and our care specialists will kind of triage you and what you need, whether it's the ICSS team or whether it's getting to our children's building or, talking to our BHUC after hours or doing some texting for crisis and stuff. They will help kind of triage you. But again, 988 is an important resource. And then last but not least, listen, we have a lot of grief in this community, and that's not necessarily all from suicide or knowing somebody that has ended their life, but we have grief for lots of reasons. COVID has caused a lot of grief for people. The water crisis certainly has, but we have a local grief support group that meets Thursdays from 4 to 5:30. It's free. You can certainly call this number that's on there and they will help you get connected with that. And I believe that this one, yes, this one is in person, I think, or it could be virtually. I think we offer both. So when you call that number, they will help set you up with all of that. Okay, shoo, I'm done. Are there any questions?
You're fantastic. No need to be worried. Okay. You said 2 things that I'd like to reiterate. We are all a safety net in our community. That feels so important and it feels so central to all the work of everyone that's been on the webinar today. So thank you for that. The other thing is you said responding with things like that must be hard. And I think as a physician, I know having like tools in your tool belt can be really helpful. And it was just, I took that away as a thing that I'm going to store away for verbiage that I'm going to use if someone responds to me or if I find myself in a scenario like that. Just having those keywords in your pocket can be sort of a go-to or a nice transition for a conversation. So I really appreciate your expertise and support there.
Thank you, EJ. And honestly, some of those skills I've learned with around my kids even, like instead of questioning why they're upset, just acknowledging that they can have the feelings and you say, wow, I can't imagine that.
Yeah. We must be reading the same parenting books. Thank you so much, Carrie. All right, we're going to wrap up with some really wonderful information and really timely information about Genesee Health Plan. And they're going to talk a little bit about Medicaid redetermination, but also a drive-through vaccine event that they have going on. So thank you so much, Shannon Cezak.
Thank you so much, EJ. I really appreciate you having me on the webinar today. So as I'm sure most of you are aware, Medicaid redetermination or re-enrollment or the unwinding is currently happening right now. That's a lot of big words and language. So what does that mean? If anybody signed up for Medicaid or Healthy Michigan plan during COVID, when the public health emergency was going on, they have now reverted back to annual redetermination or re-enrollment. So everyone that is currently on Medicaid and Healthy Michigan plans, they do need to re-enroll, and they will be getting packets in the mail. If you have any questions about, what's going on or what you need to do, you can call Genesee Health Plan, and I will put that phone number and our contact information in the chat. But like I said, with the public health emergency having ended now, they're requiring individuals on Medicaid or Healthy Michigan plan to re-enroll. I did get a chance to speak with our MDHHS worker this morning to get some more information. And this is very important to know that if you have more than one individual in your household that is on Medicaid or Healthy Michigan plan, this includes kids and adults, you will receive more than one packet. So please do not throw anything away. You want to hold on to that packet. And if you're not sure what to do with it, you can call Genesee Health Plan and we will walk you through the process. Also, for those that no longer qualify for Medicaid or Healthy Michigan plan, you would be in a special enrollment period. So we could also enroll you into a plan that suits your needs into healthcare.gov marketplace. And they're providing tax credits now, making plans a little bit more affordable for individuals that need healthcare coverage that no longer qualify for Medicaid. Next slide, please. So as I was talking about before, what we're finding is that a lot of individuals are not aware that they have Medicaid. They're correlating Medicaid with, oh, well, I've got Blue Cross Complete, or I have HAP or McLaren, Meridian, Molina. They're not correlating or connecting Medicaid and Healthy Michigan plan with their actual plan that they're on. So as you can see on the slide, if you see any of these logos or anything on any paperwork that you receive, or if you see MDHHS on the paperwork packets that you will receive, know that that is your healthcare coverage. Next slide, please. Some important dates to remember that we have coming up for healthcare coverage. Medicare open enrollment begins on October 15th and it ends on December 7th. And Genesee Health Plan has certified application counselors and navigators that are here to help you enroll. So if you have any questions at all whatsoever, please give our office a call and we can set up an appointment and help you. And then healthcare.gov marketplace open enrollment begins November 1st, and then it ends on January 15th of 2024. We're actually going to have a healthcare coverage phone bank the day right after the start of open enrollment on November 2nd. And that's going to be through WNEM TV5. More information to come on that, but we're going to have a lot of really great information to share with everyone during the healthcare phone bank. Next slide, please. And lastly, we just wanted to discuss today our annual drive-through vaccine event, which is happening next Friday, September 22nd at the Genesee Health Plan office from 3 to 6 p.m. I do apologize. We did get word that the new COVID booster will not be available at our event. We are uncertain of the when our vaccine partner will have the supply for that. If anything changes, please check our website for updates. We can be found at geneseehealthplan.org, and I will put this information in the chat. But we will have flu, Tdap, and hepatitis B vaccines available. This event is the 10th anniversary, actually, since we've been doing this. And I remember when I got hired in at Genesee Health Plan, it was the first time that we ever did this drive-through event. And I remember my boss telling me, hey, we're going to do this. And I was thinking to myself, well, that's interesting. How is that going to work? I've never heard of anything like this before. And what's so amazing about it is that this event has turned into an intergenerational event where we see families come together to the event to get their flu vaccines together. Or even if they don't want to get their vaccines, we provide them with the information and education that they need for them to make the most informed decision about their health, to decide whether or not a vaccine is appropriate for them and their family. And that's what we like to do here. We want to make sure everybody has appropriate education and information to make the best decisions that they can regarding their health. Additionally, at the drive-through, you literally can roll down your window, roll up your sleeve, and get your flu vaccine in one of our drive-through bays. We will have Walgreens and the Genesee County Health Department providing vaccines, and the Genesee County Health Department will be located inside of our office. We will have free ice cream. I mean, who doesn't like free ice cream? We're going to have some gas card drawings, back to school giveaways for kids, healthcare coverage enrollment and resources like I talked about earlier. And we're going to have American Sign Language interpreters available for the event. And that's going to be through our community partner, the Communication Access Center for the Deaf and Hard of Hearing. Again, the event is next Friday, September 22nd from 3 to 6. Next slide, please. And we are also bringing back, we started this last year, a clothing giveaway for adults and children. And that is going to be provided from our community partner, R.L. Jones. And we're very happy to have them back again. And it went over very well last year. We had several families that came to utilize the clothing closet, and they will also have basic needs and essential items available as well for attendees. And last but not least, we will be having Genesee Community Health Center on site again this year, providing Narcan basic training. If you're not familiar, what that is they're going to show individuals how to identify an opioid overdose and safely administer the reversal drug Narcan. And they're going to provide kits with the training. It's very important for individuals to have this training. I took it last year. It did not take a whole lot of time, but I got a lot of really wonderful information. And with the opioid epidemic really hitting home and happening here in Flint and Genesee County, it's really invaluable information to have. So at the very least, if you just come here to take the training or just come here for the clothing closet, that's fine. You don't have to come and get your vaccine only. You can come for any one of these offerings. It's a community event. And like everyone's saying, we all work together and partner together to make sure that everyone in our community has access to quality, affordable healthcare and resources and whatever they need to get on their feet. And I am just so very grateful to have been on this webinar today with the Genesee Health System, with all of our different community partners, the Flint Registry, MSU Extension, and I know I'm forgetting a few, but we all have partnered in one way or another to ensure that everyone in our community has access to what they need when they need it.
Thank you so much, Shannon. We really appreciate all of your wonderful expertise. Thank you so much to everyone, all the wonderful information we had today. Don't hesitate to follow back up with any of the numbers that are in the chat. We will see you next week, continuing education units for our community health workers right there.